Innovation is quite simply, how can we make tomorrow better than today? I don't think innovation necessarily has to be groundbreaking, but I think we're in the world of everyday innovation. I quit my job, rented out my house in 2016, and we set up ImproveWell, and that's almost 9 years ago. It was very scary. It was a complete leap of faith. I think people thought I was a little bit mad. Progress can be invisible at times. Don't underestimate the conversations that are going on when you're not in the room. ImproveWell captures real-time insights from the front line. NHS staff are full of brilliant ideas, but they often don't know where to go to share these ideas. It's about giving staff a voice 24/7, day shift, night shift. Whether you start and finish work in a different place, you've got a digital platform to capture that feedback. People were checking emergency grab boxes, a few times a day. Someone suggested a tamper-proof seal on the grab box. If the tamper-proof seal is intact, it clearly hasn't been opened. This reduced the checks, down to sort of, once a week, saving a huge amount of time. Another wonderful idea was having amnesty boxes in changing rooms, because clinical staff would just go home every day with their pockets filled with unopened swabs and bandages. They would empty out their pockets every day rather than taking it home and then it eventually going in the bin, and reuse stuff. Imagine what you could solve if every maternity team around the country was using this.
Welcome to Inside Health Innovation. Today, I'm thrilled to welcome Lara Mott as my guest. She is the co-founder and CEO of an award-winning platform called ImproveWell. ImproveWell helps NHS frontline staff to bring in innovation into their everyday workflows. Lara has an absolutely impressive background in investment, biotech, and life sciences industries before she decided to co-found ImproveWell back in 2016. Recognized as one of the top 50 female leaders in the UK healthcare industry, she has led ImproveWell to multiple awards, including Digital Solution of the Year. In this episode, we'll explore her journey from pharmacology to health tech innovation and everything in between. Stay tuned for an inspiring conversation with a true healthcare innovator. Hi, Lara. Welcome to Inside Health Innovation podcast.
Thanks, Karina. Thanks for having me.
I'm so excited to finally interview you, because a lot of the time, as you're my mentor, you hear me talk. So today I get to talk to you about your journey.
Excellent. Looking forward to it.
Great. So let's get started, Lara. The first question I ask everybody is, what does the word innovation mean to you?
An excellent question. I think this is something clearly we're very passionate about at ImproveWell. For me, innovation is quite simply, how can we make tomorrow better than today? I don't think innovation necessarily has to be groundbreaking, but I think we're in the world of everyday innovation. Yeah. So that's how I view it, making tomorrow better than today.
That's brilliant. What a great answer. So let's start perhaps by going back to the beginning of your journey. So you studied pharmacology in university. You topped your university, might I add, as well. But then you decided not to go down any scientific field after that, even though you were offered a place, I think, in PhD. Why did you choose not to?
Yeah, it's something I've often thought about, actually. I chose pharmacology at university because I wanted to understand how drugs were developed and designed and how they affected the body. But I think I realised I like people more than I like pipettes. I wasn't really destined to be at a lab bench. So I kind of found my way into the world of communication through various roles that I'm happy to share.
Yeah.
So yeah, as much as a PhD would have been wonderful to further the field of science, and huge respect for anybody doing that, for me, it wasn't my calling.
Yeah. No, it sounds like, as you say, it was more about the people. So then you went off and sort of had a great career in biotechnology and investment. So tell us, I guess, a bit more about that journey and how you got to transition into healthcare innovation.
Sure. So I first landed a summer job as a receptionist in a investment firm. That lasted 2 days, and they realised that I could probably trained to be an analyst with them, which I did for a couple of years, and it was great. There was no healthcare there, but I did learn how the world of venture capital and investment worked. So that was really exciting for me to sort of figure out a brand new industry that I'd never really heard of, being a scientist by trade. I then spoke to a few people and heard about an organisation that is now FTI Consulting. So I applied for a job there and got a job in the life sciences team. So I inherited 12 biotech and pharmaceutical clients, helping CEOs and CFOs grow their businesses. I then decided I wanted to go in-house and be a specialist for a particular company. So I worked for an organisation called Oxford Biomedica for 4 years. And then I worked for an allergy company called Circassia Pharmaceuticals. And then my forever job was meant to be Director of Investor Relations for a healthcare specialist investment firm. That is what I was working towards, and that, you know, I felt like that combined all of my experience. I could work for a firm that was investing in these companies, but also help work with these companies directly. And that was the first half of my career.
Before you got into ImproveWell. But before we get to that part of your journey, so when you were doing all these roles, and obviously you were ending up in perhaps your forever job as you described, just explain to us, what does that mean? So, you know, someone who doesn't come from that kind of world, or perhaps is more public sector, certainly in my career, what does a director of investor relations mean? Like, what is it that you have to do?
So for the publicly listed companies that I was working for, they were listed on the stock exchange. I was essentially responsible for understanding all of the problems and challenges that we were solving as a business, and then communicating that to shareholders, the media, patients, even internal communications. So I guess I trained in understanding challenges, and then identifying the solutions that we were going after, and then communicating that to everybody. So for my role before this as Director of Investor Relations, I was really responsible for looking after the investors that were backing this particular private equity firm. But because of my background, I also got to work with the investment team. I also got to work with the investee companies. So I helped them launch websites. I helped them with some of the transactions that they were doing. So it's all about communicating information to the right stakeholders at the right time.
And the purpose of that, I suppose, is to make sure that the value of the company is clearly communicated to the markets.
Absolutely. Yeah.
Oh, that's really interesting. I guess, I mean, so considering that background, and obviously you've talked about how you prefer people to pipettes. I like that. What kind of role do you think those skills have then played in your journey as an entrepreneur? Because they feel like a really good set of skills that every entrepreneur should come with. But tell me if you feel like they are perhaps the biggest strength you brought to this role you have now.
It's funny because I think everybody assumes the skill set they have, everybody else has. But I have definitely learned along the way that my skill set lies in communication and people and that sort of thing. And I think people buy from people. So I think what it's brought for me in my entrepreneurial journey is being able to build relationships, being able to rally people around a mission and a vision and values. Importantly, persuading people to work with us, to partner with us, to use our product. So I'm very big on communication, from internally with my team to, my investors, to my customers, to my partners. So I do think it set me up really well. So stakeholder engagement really is a core part of any business.
And it feels like, I mean, as much as obviously stakeholder engagement is one big dimension of it, it feels to me, and I feel like sort of in our business as well, communicating the value of your proposition explicitly, the impact it can have, the value it can generate for your stakeholders, I guess. And you perhaps sort of cover it in that sort of wider stakeholder engagement dimension. But that sort of almost communicating, we talk about product market fit, but almost communicating how your product fits the market is a skill that isn't easily, because I find that as an entrepreneur myself, in my head, I'm really clear why this is going to bring value, but can I really communicate that clearly enough to my stakeholders? It doesn't always come easily, does it?
No, it's challenging. And I think you might be communicating your product in a
Yeah.
different way to different
Yes.
stakeholders. So, you know, to the users, you've got to tell them, what problem does this solve for you?
Yeah.
To your investors, you've got to explain, how are you going to build growth in your business?
Yeah.
To your buyer, you've got to communicate return on investment. You know, why is this solving a problem for you, and how is this going to save you time or save you money, and a business case. So funnily enough, we have a set of materials internally to train our team. You know, this is our value proposition if you are speaking to these different audiences, because it's all centered around the same product or solution, but actually different things matter to different people. So I think that's what I love about the world that I'm in and my career before, is that when you're communicating with different people, the mission of the company, the products that you're developing, whatever it might be, it is a slightly different message for the media than it is for, you know, the internal team, than it is for your partners, patients. Everybody needs slightly different information.
Yeah, and that's such a good point, that I don't know if everybody kind of knows as soon as they come into this space. Do you feel like that kind of is more acute in the healthcare space? Because, you know, I've never done anything else. So certainly for me, sometimes it felt really complicated at the beginning anyway. Hopefully we've gotten a bit better at it now. But, you know, say our product ultimately has an impact on patients, but the buyer is an exec in a hospital who might have, obviously they have patients' best interest at heart, but they might have other financial performance related priorities. But the users might be the frontline receptionist or whoever, you know, it could be a clinician, whoever. And they will have a very different view to it, and sort of almost sort of pulling that, as you say, a communication plan which sort of communicates the value of the product differently to all of those. I found quite complicated at the beginning, but maybe I felt this is unique, and you know, that's what I'm asking. Do you agree? Or acute in the healthcare space, because we've got the patient at the end, and everything we do in the healthcare space ultimately has to benefit that patient. So there is an added dimension, and maybe I've felt that it's more complicated. But yeah, tell me.
It is complicated.
You have
I guess this is the only sector I know as well, really. So as much as I have worked in on the investment side of things, it's still very much been focused on healthcare. Yeah. I think it's communicating at different stages. So for example, we are a B2B SaaS business, so we don't necessarily need to communicate with patients. So we don't have a presence on Facebook, for example, because our buyers, I suppose, are not on Facebook. Now, our users might be on Facebook, so the medical workforce. But if we focus our communications too heavily on Facebook, I'm not sure that it's going to support our commercial strategy. But it is important for the world to know what we're doing. And I think in pharmaceutical companies, when you're about to bring a new drug to market, there will be a massive campaign that goes behind bringing that drug to market, that focuses on different audiences to perhaps what the internal teams have done for the decade before, which has been more focused on attracting investment, attracting employees, attracting partners. So it probably changes over time, and you know, that's why things like your website is really important, because it's your shop window, but who's your website for? And sometimes you have to just pick your key audiences and know that you're not gonna cater for everybody, but you're targeting the right people for this moment in your journey. So it is complex. I don't know that healthcare is necessarily more complex than other industries. Yes, it's heavily regulated, so you have to bear that in mind in terms of the information you're putting out there. But for us, selling our software to other businesses in a B2B model, I don't know that it's more complicated than others. I think communications in general is just quite, layered.
Yeah, and quite a skill. One last question just on this topic, I guess, is, so obviously you're absolutely right, and we're kind of in a similar position. We're also B2B. So, all our comms will be towards the healthcare sector, as in the organizations, as opposed to obviously patients. Do you think there is a space for either companies like us, or perhaps not so much us, but actually the healthcare sector themselves, so the NHS, I suppose, is who I mean, to communicate that kind of innovation that they are taking on more explicitly to patients? Do you think there is a gap there? Because I feel like, if, as a user of the NHS, I don't know what goes on in my local trust, what they're doing to improve things. Are they embracing new innovation? And sometimes I wonder, maybe because of my leaning anyway, but would the average person not appreciate knowing what they're doing in the NHS? And is there enough of that out there? I know since West Treating and the new government has come into play, there's obviously a lot of talk about key priorities and things like that. But just in this current landscape where it's a real flux of what's happening, everything's changing, could there be more of that? Or do you feel like it's kind of, it's at the right level?
It's an interesting question. I guess from my background, I would know where to look. So I would look at the press release section on NHS Trust websites.
True.
I'd look at their annual reports. I'd look at their Twitter feed, their LinkedIn.
Yeah.
So if I wanted to know what they were doing, I would go and read their strategies.
True.
Now, that's as a professional in the industry.
Yeah.
As a patient, would I do that? I don't know. So if I'm a service user and I'm going and walking into a waiting room or that sort of thing, maybe I'd be looking around to see if there's things on the wall or that sort of thing. I know a lot of our customers are really good at putting posters up on the wall and letting people know what they're doing. So I would say, I think, because I'm probably in the space, I know that they're working very hard on these things. It is fragmented, but I do think that certainly the NHS is trying to embrace innovation and is trying to share their successes in award ceremonies, things like that. And sort of spreading that knowledge of what they've done. It is fragmented. Maybe they could streamline things a little bit more, but I think there's probably a lot going on more than the average person would realise.
Yes.
So I see a lot, but that's probably because I know what to look for.
Yeah, exactly. And I guess I was asking you this question because you come from this background of, helping publicly listed companies. So if you were the comms advisor or the investor relations director at the NHS, really what I'm trying to understand is, would you be doing anything differently to what they're doing today?
Gosh, yeah. I don't know, because I guess there's no real central place that you would go, as much as we have had these national bodies and national movements, everybody still has their regional and local priorities. So that would be a big job, I think, to streamline all of it. I think there's been a lot of initiatives over the years to celebrate successes, share what works. The HINs were, of course, there and set up to encourage the uptake and spread of innovation. So there's always room for improvement, of course. But I do think there is a lot that is out there to celebrate and recognise success. It's just an enormous market. The NHS alone, with, my goodness, 900 different individual organisations. How do you streamline all of that effectively is quite a big challenge. So I'm not sure I'd be any better at that job than anybody else. But I know that there are comms teams working very, very hard to surface the good stuff. We play a little bit of a part in that, in what we do. Yeah, no, that's great. Thank you. So coming back to ImproveWell, you've got a co-founder as well. So tell us a bit about him and I guess how you both got together to start ImproveWell. Yes, so my co-founder is Dr. Naeem Ahmed, and we actually went to school together. So almost 29 years ago, we went to Kingston Grammar School. I was the year above. So I'm sure Naeem always looked up to me. I guess through the power of LinkedIn, really, Naeem followed my career and he approached me when I was at GHO Capital, which was my forever job, and asked me to get involved with a pilot concept that he was delivering. He'd got a grant from Guy's and St Thomas's charity to build a junior doctor feedback app. He was a junior doc at the time. And I loved this concept of capturing the voice of the front line, they often don't know where to share their brilliant ideas, and this seemed like a no-brainer to me. So I helped him with that pilot from a communications point of view, interestingly enough. And then he secured a spot on the Digital Health London Accelerator, which was the first one back in 2016.
Wow.
So, he said to me, I'm a full-time clinician. I see 100% of the issues on the front line. I love being in the NHS. I don't know how to build and scale a software business. Do you want to go into business together? So, I kind of bring that commercial expertise. I had no idea how to scale a business, let's be clear, but we had a good partnership in terms of that left brain, right brain, very complementary skill set. So I quit my job, rented out my house in 2016, and we set up ImproveWell, and that's almost 9 years ago now.
Oh, wow. And I guess leaving what I can only assume was a well-paid job in the private sector to come and sort of come into a startup environment, be an entrepreneur, which obviously means you've got a lot of the risk and all the challenges that come with sort of starting a new business.
Yes.
How did you make that leap? And what made you take that leap in the first place? Coming from that security to perhaps uncertainty.
I think people thought I was a little bit mad. I've always had huge respect for anyone wearing that blue lanyard, working in the NHS. I always wished I'd perhaps studied medicine at university with a degree in pharmacology. I always had that thing in the back of my mind. Maybe I can go back and study postgrad medicine and make a difference. So when Naeem came to me with this opportunity, I thought to myself, okay, well, we're on a 12-month accelerator program. So I've got sessions every week, every day, I think at the time. So I've got a bit of a framework to navigate this, because I had no clue, other than using the NHS as a patient. I had no idea how it worked. Still don't really know. And
don't we all feel that way?
So I thought to myself, okay, well, I've got some savings. This is my version of postgrad medicine. I'll give it a year and we'll see how it goes. And if you don't try, you never know. I knew I had enough savings, and I was kind of consulting in the early years of ImproveWell with a couple of clients that I'd had in the early days of my biotech career. So I kind of made ends meet. And ImproveWell was sort of my side hustle for that year. And then things kind of took off. So I gradually 1 year became 9 years. But it was very scary. And it was a complete leap of faith. But it's been, as much as it's been incredibly stressful, and you're just solving different challenges every week, and the problems you have today you wished for 9 years ago, but when you're dealing with them today you're thinking, gosh, how am I going to navigate this? But it's been incredibly rewarding. And obviously I feel like I found my place in the NHS doing what I do well. And obviously setting up a business with Naeem has just been brilliant.
Oh, that's a really good ending to your uncertain journey at the beginning. Was there any point where you felt, okay, now I can stop everything else? And what were the variables that let you to feel that way?
As in to stop
anything else other than ImproveWell? Because you said you gave yourself 12 months.
It just got really busy. So I guess I would say to anyone setting up a business, you have to be prepared at least for a year, but for as long as possible to sort of not earn any money, because you just don't know. And anybody who's set up a business will know that feeling of, gosh, okay, how am I going to pay the mortgage this month? I actually rented out rooms in my house and that sort of thing. Wow. So I did lots to sort of cover my costs. It got busy, and so eventually we got to the point where we were generating revenue from our customers, and it started to allow me to grow the team. We have raised investment, so that obviously did help. So we've got some very supportive investors, and once you can take on investment, you can pay yourself a modest salary, and step by step. It's funny thinking back to it now. I've never really been asked that question before, but I did get to a point where I thought, actually, I see a sustainable path here. So I can I can drop the consulting bits and or the freelance bits, I should probably call them, and focus full time on ImproveWell. Yeah.
Okay, brilliant. So let's talk about ImproveWell. So tell us all about the platform, what it does, and how does it help NHS organisations?
Yeah, so ImproveWell captures real-time insights from the front line to help teams continuously improve. So it's kind of like a digital feedback loop for improvement and action. And yeah, it's a smartphone app. So it's available on devices or on the website. If you think you're a doctor, nurse, porter, physio, anyone that's sort of doing the day job, interacting with patients, you see 100% of the issues. And coming back to that point on making tomorrow better than today, it's asking those highly skilled people to be the eyes and ears for your organization and asking them, what one small change would you make today to make tomorrow better? The beauty of health and care staff is when you ask them how to make tomorrow better, they are the biggest champions for patients. Yeah. So you will get ideas for saving time, saving money, reducing waste, improving staff experience, but importantly, delivering better, safer care. Yeah. So that is the premise of ImproveWell.
Oh, that's brilliant. So if an organisation buys the solution, they're able to give everybody in the organisation access to it. So if I'm a large trust, anybody can get access to it. And what have you found? Do they do that, or do they do it with select groups? How does it work?
Yeah, so we're very flexible. So we can sell to a department or a hospital or a trust or an ICS. So it really depends on the size and scope of your program.
Yeah.
We're definitely very popular in certain areas. So we've got lots of case studies in maternity services, emergency services, ICU, pharmacy, pediatrics. So I think there are certain pockets across the organisation who really embrace a platform like this, possibly due to the nature of their environment. It might be fast-paced, it might be intense, it might be very obvious how these improvements could make tomorrow better. But interestingly, we're used in underrepresented groups, so estates and facilities, admin and clerical staff. So it is available for everybody. The gold standard really is to license it across your organisation and make it available to everybody. There will be pockets of your organisation that are the super early adopters, and there'll be others that might come later on. But really, if you're capturing the voice of a representative group in your organisation and you are making improvements, everybody is going to benefit from those improvements. And so you kind of expand that reach as you go. And we call that the halo effect of engagement. So.
No, that's really interesting. So if I'm a user, do I also get to see other people's feedback in the application so that I know kind of what's happening around the trust?
Yes is the short answer. The longer answer is it's a confidential platform by nature. So it's not a social platform. It allows organisations to ask the right questions at the right time, and also doesn't ramp expectations that people are like, well, hang on, I've shared this, I've shared this feedback, what's happening with it? There are ways for people to access an ideas feed and vote. Some organisations and some teams are very open and social in the way that they set it up, so everybody sees everything in real time. Others will run a bit more of a structured process so that they can gather all the ideas into their improvement log, triage what's coming in, spot trends and pressure points, prioritize, and then complete the feedback loop. So it really depends on how sort of your project is running. So you can use the solution to support large scale transformation projects, which take a different pace to perhaps a pharmacy team using this for their kind of daily innovations or their weekly team huddles or their monthly staff meeting. You can also capture the voice of the patient through this as well. So that might be through staff interacting with patients with an iPad and capturing their feedback. We do have a portal for patients to also share their feedback as well, with that concept of quality improvement being kind of co-production and capturing the voice of the patient which is important in all of the things that we all try and do in the NHS. It's been designed for the dynamics and the sort of on the ground pressures that we're familiar with as a dedicated supplier to the NHS. We know what works. We know who needs to see the right information at the right time and the right frequency. So it's there for it to become part of how we do things rather than another thing for somebody to do. Because this stuff's already happening. The conversations are already ongoing. They're just not being captured in a way where you can surface it and learn from it and then spread those learnings to other areas of the organisation.
Yeah, no, you're absolutely right. I think, as you rightly say, the frontline staff have so many ideas and probably are the best sort of source of getting those ideas, as opposed to, perhaps external support in that way. But it's not perhaps captured as well as something like ImproveWell can. And so just sort of finishing that feedback loop that you've talked about. So people have entered their feedback either through sort of maybe daily campaigns or very specific ones, as you say. That's all been entered. What happens next? What does the organisation do with it? And how does that then loop get closed? I guess?
Good question. So there are 3 feedback systems in the platform. The heart of it is improvement ideas. So people can share an idea, they can keep track of their ideas, they can vote on other people's ideas, and they can read improvement reports. So if I share an idea for improvement on the app, that comes through to an improvement log. We've then got what we call a group lead. So that could be a manager, that could be a head of a department. It could be everybody. Everybody could be a group lead. It just means you can see the information coming in. And then we have a super admin that can see absolutely everything across all of the working groups on the platform. So we gather the improvement ideas or the sentiment, how people are feeling at work, or survey responses. Then the group leads are responsible for reviewing, actioning, grouping, whatever it might be. Our dashboard is intelligent and smart, so it will group things and show you, where the trends are. And then you make the changes, and then you publish an improvement report back to everybody. So there are digital feedback loops throughout the platform. It doesn't all necessarily have to be in the platform. So lots of people will discuss the data from ImproveWell in their team meetings. They will print stuff off and have it on notice boards. They will share results in a staff newsletter. So the tool is there to be a central platform to capture this real-time data that otherwise isn't being captured. How you then communicate that back can be through the platform itself. But it should also be in team meetings. It should also be in other methods of communication, so that you are making sure that everybody knows what's going on. To your point about sort of visibility, you don't just want to be consuming stuff through an app necessarily. You want to be reminded of it in lots of different ways. So it ideally becomes the way that we do things in an organisation, and then feeds into all of the other processes that are going on.
Yeah, no, it's really interesting. And so if I asked you to kind of like sort of hone in on the key problem that you feel like ImproveWell is solving for the NHS, and equally, something that you're specifically passionate about solving. What is that? And I guess, what's your product market fit?
So NHS staff are full of brilliant ideas, but they often don't know where to go to share these ideas. And sometimes these ideas may be considered too small to go directly to the chief medical officer or the chief exec or whoever it might be. So in its simplest form, we are giving staff a voice. We are capturing their great ideas at the point of care. And the problem we're solving is there is no central digital way to do this. It's often pen and paper, an email inbox, an intranet, verbal meetings, a meeting once a month. And these are all great processes. But if you don't have your idea at that specific time, and you have it on the bus on the way home or on a Sunday when you're out walking the dog, where do you share this feedback? And Naeem often talks about, as a clinician, there are important processes like the annual staff survey, but that's one snapshot in time where he gets asked, how does he feel as a member of staff? How could things be better? So It's about giving staff a voice 24/7, day shift, night shift, whether you start and finish work in a different place, you've got a digital platform to capture that feedback. So so I guess that's the problem that we saw, that you know, we want to make sure that staff are heard. But it's also about making quality improvement everybody's job. You know, why should you just be siloed as you're just a nurse or you're just a physio or you're just a doctor, when actually you can get everybody tackling these problems from the ground up. So you can run big corporate initiatives across the platform. So if you're working towards net zero, ask your staff. If you're trying to reduce waste or improve culture or improve patient safety, ask your staff. Everybody's going to have ideas of how to do that, whether it's very small or enormous care pathway redesign. That's fine, but make sure you're involving everybody in that. That's a very long answer to your question.
No, it makes perfect sense, because you know, even if, because I guess what came before something like a digital platform that ImproveWell is offering, I guess, you know, in my time in the NHS, they've come under different names. You know, there's been listening events, there's been big conversations. They call them different things, but what really was we all know there's a problem in, I don't know, say maternity. Let's get all the maternity staff into a room and ask them, how can we improve this? Have little sort of group chats to do that, etc. And I was just sort of reflecting back to, as I've been part of some of these, that, it was useful to do that. But again, it's very much like a snapshot.
Yeah.
Rather than, I had an idea, you know, walking the dog, and being able to share that. But equally, as much as I'm sure those events were well captured and tracked, etc., as we're really good at doing in the NHS, there wasn't this sort of very clear digital footprint, which you can't ignore. And what I really like about what I think has come out of what you've said is how these small ideas can then add up, can't they?
Absolutely.
Because one idea might be too small to go to the CMO, but you add up about 10 ideas and together they might work to be a really big solution and have a really big impact.
Yeah, I mean, I guess, and I'm very passionate about this topic, so I could talk for far too long on this, but I think all of those processes are really good.
Yeah.
So I think you should have the hackathons and you should have the workshops.
Yeah.
You absolutely should ask people, how do we solve these known problems? But what about the unknown problems? And the you know, every season, when you go from spring to summer to autumn to winter, there's pressures on the health system. And the pain points that staff are feeling are different. And then you get COVID that comes along and makes it even worse. And then you get something else. So the goalposts are always moving. And so being able to understand what matters to staff, they can be your smoke alarm for patients. So ideally, we want to help healthcare become proactive rather than reactive. These conversations are already happening across organizations, but having a digital platform gives that evidence to go, do you know what? We asked our team, 10 people said the same thing. Let's make that happen. You know, it might have been flagged before, but nobody maybe realized how urgent it was to do this. And we've seen this time and time again. So exactly as you say, with that digital footprint, with that database, with the data insights, with that collective intelligence, and this is where our AI models are going now, is, you know, these ideas all look the same, or this is a brand new idea that's just coming. We've never seen this before. It's an outlier. Do you want to have a look at it? Because if you are a listening organization and you are gathering that collective intelligence, it's that Toyota Kaizen continuous improvement philosophy for healthcare, you are going to deliver safer care. This isn't, and I know Naeem said this before, this isn't necessarily just another HR app. This is actually about the safety of service delivery, the safety of patient care, the quality of patient care. It's making improvement everybody's responsibility. So if you spot something that could be done better, that makes your experience as a member of staff delivering care better, say it, put it in the app. You know, then it's going to be considered. Not every idea needs to be actioned, but you are contributing. You are the eyes and ears of the organization. You're taking responsibility. And I think then imagine what you could solve if every maternity team around the country was using this. You know, imagine what you could achieve with that. So I was really passionate about this from the beginning, because I kind of felt like, yes, we seem to be solving something that probably, you know, isn't a new concept. The old suggestion box, the ideas box, this is not a new concept for any industry. You know, Sainsbury's has a suggestion scheme. The John Lewis Partnership has a suggestion scheme. But actually bringing it in a digital form into a healthcare setting, which is pressurized, and they're very large, geographically disparate workforces, needs to be done in a certain way. So we've worked very, very closely with our NHS customers. We've designed every single feature with our NHS customers. It works. But yeah, it's these marginal gains. It's proven in other industries. You know, these small ideas can make a big impact. And so if you can just get into that mindset of continuous improvement every day, you'd be amazed at what impact the workforce can have. And that, you know, working for a listening organisation makes you feel better. So then you're starting to tackle big things like staff retention, staff satisfaction, absenteeism, you know, which is really important.
Now more than ever. So let's talk about impact. You've obviously been running for 9 years, so in several organizations. Tell us, what kind of feedback have you received, but equally, what kind of impact have you seen the app have in these organizations?
Gosh, yes. So it's widespread, really. I think in the beginning, we were thinking, okay, well, these ideas save time, they save money, they improve staff experience, they improve patient safety. We've now seen that kind of spread wider in that we have helped organisations improve their CQC ratings. We've seen scores in the NHS staff survey improve. We've seen people improve their retention metrics in their departments or their organisations. So there's lots of examples that I can give, really great ideas from, for example, one that I often say is people were checking emergency grab boxes, you know, a few times a day. So they would open up the grab box, make sure that all of the equipment was in there, you know, close it, write down that they checked it. So someone suggested a tamper-proof seal on the grab box. If the tamper-proof seal is intact, it clearly hasn't been opened. So this reduced the checks, you know, down to sort of, I don't know, once a week, if that, saving a huge amount of time. Another wonderful idea was having amnesty boxes in changing rooms, because clinical staff would just go home every day with their pockets filled with unopened swabs and bandages and bits and pieces. And so they would empty out their pockets every day rather than taking it home and then it eventually going in the bin, and reuse stuff. And then they were calculating the cost savings that they were making. Now, these are small things that when you see them being implemented, people then start to think, okay, well, I've actually got a really good idea about X, Y, Z. We also have ideas of people improving security. You know, they've noticed that perhaps security measures on what they should be, you know, in certain areas in the hospital. We've had people, 10 people in one department suggested the same idea, which was, why did they have battery operated clocks, you know, in all of the rooms? Because if you're moving a patient from one room to the other, one clock says it's 11:58, the other clock says it's 12:01. At what point did they get administered their medication? You know, it starts to become a safety issue. So again, this was something that had been discussed readily, but when you see that X% of your department are really focused on one thing, you know, that got escalated and the digital clocks were put in. People have spotted things with newborn babies, so introducing cuddle coats for skin-to-skin contact to give people a bit of privacy, particularly partners who perhaps don't want to sit there, you know, and be half undressed, you know, for the skin-to-skin contact, or cupboards for keeping blankets warm for newborns, or just things like this, where actually little things that that make patients feel like, you know, they are having an improved experience. It makes staff feel better that they're giving quality care. Nobody comes into the NHS to give poor quality care. They all want to do a really good job. So Yeah, the ideas themselves, they will save time, they will save money. Importantly, they will flag things that can improve safety, that can help everybody give the best possible care to the populations that they're serving. And that then improves staff satisfaction. And there's a huge amount of evidence that happier workforce leads to better, safer care. It is just proven. And so that's why we're doing what we're doing.
And can you share any numbers, sort of maybe from individual organizations around sort of quantifying some of this impact of, like, sort of aggregating these ideas together? Appreciate, it's hard to do that, but is there any sort of analysis you've done?
We do have an impact calculator on our website where we've put together things like this. So you can say, my workforce is 300 people, I want to know how much. On average, we estimate that each idea alone is worth about £22,000, and that's based
in a year.
In a year. That's based on
the
our sort of aggregated research. Again, you can argue this if you're a manager in an organisation, you think, okay, well, I think my ideas will be worth £5,000 or whatever it might be. It's hard to give specific example. I mean, we've got tons on our website. For example, improving the CQC ratings and that sort of thing is obviously very meaningful to organisations. Seeing staff survey results tick up, I feel like my voice is heard. I feel like I can make a difference in this organisation. I think there's some research that came out of NHS employers a while ago that said for every one standard deviation improvement in staff satisfaction leads to savings of £235,000 for one NHS trust alone. I might be getting that wrong, but I can definitely find the stat on that. So again, it's very, very difficult for innovators and suppliers in the NHS to prove impact. Most people focus on time savings, cost savings, that sort of thing. So we try and tackle it from lots of different angles, so that if somebody is writing a business case for this, it might be that they want to focus on a particular area. We've got a lot of evidence to show that. But generally speaking, it's about the ideas themselves, but also the power of being a listening organisation. And I suppose the other more bleak way of answering it is, what is the cost of doing nothing? If you just do nothing, you're losing staff. You might have a lot of safety incidents going on that you're struggling to kind of get on top of. There's lots of things. Actually, the sort of cost of inaction is a big piece. So it's quite a complex area in terms of how do you prove impact? The holy grail is
it is
we save you millions and millions of pounds a year. That's what everyone's trying to go with.
Well, exactly, and I guess we're so used to hearing that when you go in front of an NHS organisation, try and sell something. Certainly, especially more so in the current climate, unless you're proving almost sort of in-year savings, it's a challenging time to be selling to them. So
it is.
So it's it's been ingrained in all of us, people who I guess try and sell innovation to the NHS, that you must have a way of calculating that impact, right?
Yeah, I mean, you have to be aligning to priorities. You have to be solving a problem for someone. I think we're all as entrepreneurs very passionate about our products, but ultimately, if you're not really solving a problem for somebody that ultimately saves time, saves money, reduces incidents, improves safety, these big things, you're going to find it hard to argue for public funding to be invested in your product or your service. So, the economic argument, the sort of the pricing, the return on investment, it's all really challenging. And even as I say this, I kind of think back to, trying to get our first customer to buy this, and I think how far we've come, and it's even now it's not easy because the environment we're in is ever changing. There's new challenges new priorities every month, every year. That's the nature of healthcare systems, and that's not just unique to the NHS, that's globally. So Yeah, it's an interesting place to be in.
Why do we do it again?
Yeah, I don't know.
So, Lara, we both work in the NHS space and we're suppliers to the NHS. And a lot of people I speak in this space often talk about how challenging sometimes it is for the NHS to embrace new innovations or take on new technologies through a variety of reasons, which I'm sure, we both could discuss forever. But really what I want to ask you is, what kind of barriers have you faced in that sort of theme, and how have you overcome them, or what's helped you overcome them?
Yes, it's a tricky thing to navigate the NHS, particularly as a brand new business. So if I take myself back to year one, we were on the Digital Health London Accelerator, which was really helpful from a credibility point of view. It gave us a wide understanding of who we needed to talk to, how we needed to shape what we were doing. We practice what we preach. So we are a listening organisation ourselves. We've stayed very, very close to our customers over the years and continue to do so. I think the main foundations for our success really was our credibility in the sense that we're clinically led. So the fact that Naeem will do his night shift and he and I speak every day, we keep ourselves very, very close to the pressures, but also we've co-developed our solution with the NHS. And I have to mention in particular East London NHS Foundation Trust. They were customer number 4 for us, and they helped to develop 2 of our feedback systems. So we had the ideas feedback system, and together with Elft, we developed our what we call the good day measure, which helps organisations understand what contributes to a good day at work. It's a sentiment tracker and a very flexible surveys module. And we knew that those 3 feedback systems were helping Elft to deliver their solution to the IHI Joy in Work framework, for example. So there was an evidence base underneath it. So the Institute of Healthcare Improvement published a white paper in 2017, and it was a framework for improving joy in work, so reducing burnout, improving satisfaction in the clinical setting, and Elft were implementing this in their hospitals, manual methods. So they had happy face, sad face paper cutouts to put in boxes. They were trying to gather survey responses using Slido, and they were gathering improvement ideas through other methods like potentially in-person meetings and that sort of thing. So they helped to evolve our platform into a digital solution for anybody implementing that framework. And that partnership really put us on the map in terms of quality improvement, which was fabulous. Since then, we've always stayed very close to our partners, and having clinical champions it has been key. So we've shared our successes through their stories, and we've made sure that we can sort of spread that success and best practice through them, and that's been core to what we've done throughout our marketing. Over the last 9 years, it's less about us saying what's great. We try and sort of hear from our customers. We do publications, white papers. So I guess in its simplest form, staying very close to our customers and listening, but also sharing their stories and having champions. So, credibility cannot be underestimated, certainly in the NHS, but healthcare more widely. So we've made sure that we've done a great job, program by program, site by site, rollout by rollout. We never cut corners. And that credibility, I think, can't be underestimated with our kind of clinical delivery partners, but also our industry partners. And I think reputation is everything in this sort of industry.
No, absolutely. And I guess, so would you say right at the beginning, when you didn't have that sort of body of evidence, as it were, or partnerships that were perhaps, referring you on and saying nice things about what you'd achieved with them, how did you get your credibility then right at the beginning?
It's an excellent question. And it's one that I've been asked by founders who are at earlier stages in their journey. There will be evidence out there. There will be reviews, white papers, publications. So for us, the Keogh review was really important. That was published in 2013, and the Berwick report, which concluded, amongst many things, that you've got to listen to frontline staff. They're the ones that are closest to the patients. They're the ones that are best placed to improve care. Yeah. So even our early marketing was featured around these big reviews, these big papers, these big strategies, because that's the evidence base. So it does exist. And if you are developing a solution, one of our core values is developing evidence-based solutions. So if you're not generating the evidence yourself yet, there will be other ways that you can draw on other reports in the industry, other pain points, other sets of evidence, data sets, where you can then say, well, here's why we've developed what we've developed, and this is the problem we're solving. So taking an evidence-based approach is something that we've done throughout our journey. Yeah. And in the early days, it was very much, this is the lay of the land, and we've developed this solution to this problem. Yeah. As we've gone along, it's been about storytelling through our customers, because the problems are the same, but they're also different. So 9 years ago, we wanted to develop an app that gathered ideas from staff. We still want to, that is still our main cause. But over the time, burnout has increased. We've had COVID. So, people in boardrooms are worried about retention rates. They're worried about resilience. They're worried about staff experience. And so, whilst our ideas app in the beginning may not be a logical solution to that, the fact that we've evolved our platform over the years in response to these different pain points and different pressure points without becoming all things to all people. We've been very, very focused on what we're developing and why we're developing it. It means that we have stayed relevant, and we've been able to make sure that the solution still meets the needs of everybody. So it has evolved. At its core, it still looks the same as the very, very first version. It's just matured, I suppose, over the last 9 years. But I think taking an evidence-based approach is critical.
Yeah, no, that's very true. And I feel like I have heard that from quite a few people about what works. And in terms of just sort of generally other barriers, were there anything that you experienced in your journey of trying to sort of, obviously commercialize the product with the NHS? And how did you deal with those?
Plenty. So I can't talk about that in the past, because there's barriers all the time.
But I guess your top barrier, other than obviously having to prove your credibility at the beginning and all of that kind of stuff.
Yeah, I think a natural barrier is, why should an NHS organisation invest in your solution? So what is that return on investment? And we've spoken about that earlier. So how do you go and prove that, particularly when you're a brand new organisation? And this is customer number 1 or customer number 2. So, people want the evidence before you've been able to generate the evidence. So it's very chicken and egg. How do you navigate that phase of people wanting it for free? Because of course, in an ideal world, sure, you'd give stuff for free. But unfortunately, if you give stuff for free, there may not be that commitment to actually implement it. It might get shelved because another priority comes along. So as an innovator, you've got to find a way of, navigating that. And of course, everybody will ask you for free stuff. We all do it, but unfortunately, there is a cost, and nothing's really for free, because it takes people's time. It takes people's resources to actually do things properly. So getting that commitment and that joint commitment and that partnership is really, really important. And when you're brand new, you're the new kid on the block, it's really hard. But then, of course, when you're more mature, you have different challenges. So you might be going up against other priorities. So, for example, if you're a hospital and you're introducing 10 new initiatives, at what point on the list are you going to put a problem like the one we solve on the list. We're not a mandatory system.
True.
So, you can't force people to A, make a buying decision, and B, force people to use it.
Yeah.
So it might be slightly different to mandatory systems who, as an organisation, you have to have, I don't know, an EPR or an instant reporting system, whatever it might be. So if you're in one of those businesses, then you're differentiating yourselves from the competitors. So, you always have a different set of challenges.
Yeah.
I think it comes back to listening, being very clear on what problem you're solving, and ultimately, crudely speaking, who pays for it? What budget does this come out of, and what is the business case for this? Because ultimately, public funding needs to be invested in the right areas. And when there are different reviews that get published and different priorities change, or, we're seeing a lot of changes going on at the moment with the restructuring of NHS England, you've got to be listening. You've got to understand how those macro developments affect the care delivery organisations on the ground, and all of the other bodies around it. So, certainly in the NHS, everything's constantly changing. I don't think it's that dissimilar actually to perhaps the US health system as well. Different structure, but similar pain points in a lot of ways.
Yeah, it's interesting you say that, because I guess it is such a ostensibly it's a very different healthcare delivery model. It's not free at the point of care. There's a big sort of private healthcare insurance. So I guess tell us more about your experience from there, as well as, you've worked in other countries like New Zealand and Canada. How different are they, and are the challenges the same? Is there something we can learn from them and bring it back to the UK?
From our experience, the challenges are very similar. So funding aside and how the funding flows, still need to have a business case. You are still dealing with an overstretched workforce. Healthcare for decades has been under pressure to deliver better care at lower cost amidst ageing populations, workforce shortages. So I see similarities across those systems. Certainly in going to the Institute of Healthcare Improvement conferences over the years, the international one in Europe and indeed the annual forum in the US, all of these health systems come to those conferences. So we meet colleagues from Canada, New Zealand, Australia, the US, of course, and the UK in particular. And those are the countries that we're trademarked in. It's all very similar issues, and actually the NHS does a lot of collaboration with these entities, and there's a lot of shared learning and shared knowledge with these different health systems, which I think is really important. So simplistically, I think we are seeing the same challenges in these health systems. So yes, of course, funding models are different and that sort of thing, but still need to build a business case. You still need to be proving impact. You still need to sing for your supper. So because it doesn't matter what country you're in, healthcare systems are under pressure.
Yeah, no, absolutely. And obviously at home, as you rightly pointed out, we're going through this big reorganization. Do you find that the current climate is more challenging in your business than perhaps it's been before?
It is challenging. Having done this for 9 years, I think we've seen challenges like this before, albeit in different ways. Over our 9-year journey, the pandemic was right in the middle of our story. And in all honesty, I didn't know if that was going to be the end of the business, because I'm sure a lot of people felt the same. We were actually really privileged to be able to help in the national response to the pandemic. So a lot of organisations started using our software to listen to the frontline, understand how their shift was, how could they navigate these new ways of working. We supported the flagship Nightingale hospitals in London and in Cardiff. So we were pleased to be able to actually help. But that was a very, very challenging time. And we've seen, obviously, now a change in government. I think over the last 9 years, we've maybe had 7 different secretaries of state for health and care. So there's been a lot of change, and actually we've still been able to deliver growth and to deliver impact and scale, the business across the NHS. We've formed wonderful partnerships. So I think being nimble and being able to sort of navigate a changing environment is something that has to be core to innovators, and perhaps maybe we're at an advantage being a smaller business than perhaps enormous businesses, because if enormous businesses are not getting enormous contracts or there's disruption to enormous contracts, maybe that impacts them more than a smaller business that perhaps is not operating at that sort of level. So yes, it's challenging, but I feel like it's been a very challenging decade for all of us in this space anyway, and the need is still there. The problems that we are solving are still there. The Prime Minister interviewed a doctor recently, and they were talking about needing ideas from the front line, and this doctor in particular, she was saying that they have these brilliant ideas and they want to improve the service, and so there are still the same issues, regardless of the turmoil that is going on at a higher level. You have to be resilient, of course, and you have to perhaps put defensive measures in place as a business, but I don't think it fundamentally changes the problem that you're solving. It's obviously harder to operate in an environment where perhaps funding has been paused or funding has been halved, or perhaps there's no visibility on when things are going to recover, but chances are things will recover, and the changes aren't being made for change's sake. They are being made with a long-term vision in mind. So you have to listen, learn, adapt, and hopefully stay focused and resilient and come out of the other side.
That's a really hopeful and positive message, which is a really nice thing to have in response to that question. So just sort of looking at the same sort of challenge from the side of the innovators out there, but equally the side of the NHS. Let's just talk about the innovators first. So you talked about obviously how important it is to understand what's going on in the industry, what are the priorities, and how you can sort of perhaps align with them. But that sort of sector knowledge is obviously key, as it would be in any industry. Yet, obviously, a lot of people feel like they can't quite access that knowledge easily. So how does the NHS work? What are the latest priorities? Where should we be looking? What would your advice be to people who are perhaps not as ingrained in the NHS as someone like me, or someone who's been doing it for almost a decade as you, and they're still at the start of their journey? Where should they be looking to help themselves out a bit?
That's a good question. Again, it is one that I have been asked before, so I think it is a really important question. I often direct people to the King's Fund. I think the King's Fund has got some excellent resources, podcasts, materials, webinars. They've got a video in particular which is probably out of date now, but you can kind of understand the gist of how the NHS works and all of the different bits and pieces. Who knows, they may have done an updated one since. There are organisations like the Health Foundation, of course the Health Innovation Networks have been set up, to help companies, small companies, navigate this system. So they often run events, they often run, I'm sure, online stuff now. It's been a while since I've necessarily had to sort of hustle in that sense and go and engage. Eventbrite, there's lots of events that you can go to. There's obviously the conferences that you can go to. Some of them are at a cost, of course, but I think if you can invest in those wisely and go and learn and absorb, then that is time well spent. I also think we do have a lovely community in digital health, so lots of companies will be happy to share their stories. This podcast is obviously a very good example of that.
I was waiting for you to say that.
And it's really important because, over the last 9 years, I've got information that I hope I can share that will help other people to make informed decisions. I do think we need to be supportive and encourage new innovators to have the best possible chance, I suppose, of innovating in the NHS. So, those are a few resources I would say. It is still a minefield, and of course we are all still learning, and none of us know, none of us have a crystal ball. But I do think certainly in the UK there is a nice digital health ecosystem, and even on LinkedIn, there are certain hashtags and things you can follow on LinkedIn. There are certain folks that are very active on LinkedIn, and they will also share lots of resources and things like that. So you can probably think of a few people who often share, the top resources or job opportunities or anything. I think people are really trying to help to share knowledge and opportunities. There's also really good WhatsApp groups and communities and networks that you can join as well. So I think there's a lot out there. You've just got to put yourself out there a little bit and ask.
And find it as well. Okay, and from the point of view of an NHS leader in this current environment where finances are indeed a huge challenge, I've been given my priorities, which include potentially sort of, losing a lot of sort of corporate staff. In that kind of scenario where I have to make lots of savings, I have to somehow reduce my corporate spend on staffing. I've got a waiting times challenge. Surely I'm also focused on, safety of patients and all of those kinds of things. A lot of people might be feeling just too overwhelmed with the priorities that they need to deliver on, the uncertainty that obviously is in place at the moment. We all appreciate sort of the long-term vision, but in this current climate, if I'm just like, I don't have the headspace to think about innovation or getting something new in, let's just carry on the way we are and just sort of hold our attention to the things we must absolutely deliver. What would you say to those people who are perhaps, just sort of staying away from something new, which might need a lot of sort of, headspace and change required because they are too busy with all those other things?
Oh, that's a difficult one because they're in a tricky
absolutely.
spot. I don't know that I would necessarily have any advice for them in terms of how to sort of navigate that, because if I put myself in their shoes and, there's 10 different things to deliver, how do you prioritize it? I don't know. However, I would say things that you can continue to do is communicate, communicate with the suppliers that you are potentially looking to work with. Tell them what your problems are. There might be an innovative solution that can come up, because if people don't tell me, I don't know. So somebody might be thinking, gosh, I can't make this decision now, but I would be able to in 6 months. 6 months in my world goes very, very fast. So if I know that, I can plan accordingly. But people may not know that actually that they can say that, and that is a useful bit of information. So again, it comes back to communication. If you're building good relationships with your potential buyers, ideally you can have this open and honest communication on, tell us what your pressure points are. So I guess I'm flipping naturally into me as the supplier. We need to listen, because so we need to ask the questions, and it's not just when are you going to buy my product, but it might be how do you see this environment playing out? What's your view on this? How long do you think this situation might last? Because it's they are going to have a different perspective to what we're seeing. We might be able to offer something to them, and we might be able to say, we're seeing organizations do X, Y, Z or whatever. There might be partnerships that you can strike at times like this, where actually if they've got to deliver 10 things, what are those 10 things? And actually, can you support one of those 10 things? And again, that might not be relevant to all businesses, but it's certainly relevant to mine. If somebody is in the middle of delivering a massive change and transformation project, can we actually support with that? Can we actually help that particular project be more successful. If people aren't able to invest in new solutions locally, can they invest regionally, or vice versa? If regionally there's no funding, is there local funding? So I guess it comes back to when things are hard, communication is key, you know. So rather than not engaging with potential suppliers because you're just worried about saying no, or you're worried about saying not now, tell them them what your issues are. See if they can come up with an innovative way of working. Maybe they can give you it for free. Who knows? You know, I know we've spoken about how that can be a little bit challenging, but you know, in unprecedented times, sometimes there are models where, you know, you can start delivering something and perhaps once you've proven impact, you know, that then informs another discussion. So I think with all of these things, communication is key, because certainly for us, we want to build very strong partnerships with our current customers, future customers. We're often talking to them for a long time, you know, potentially before they start working with us. So if you can get that communication and transparency, you can then try and problem solve together. What's really tricky is obviously if you don't hear anything, then you just don't know, you know, and it's the same on both sides. So I think suppliers need to communicate, you know, and innovate. And I think the buyers also need to perhaps explain why their world has changed and what would make their lives easier. Which sounds obvious, but it might not be. It might not be something that immediately springs to mind. Also, they might not have time. So, you know, you might not have time to go and just communicate with everybody. But you get my point.
Time is definitely, I imagine, a challenge for colleagues in the NHS. But I think you make a really, really important and good point about how industry is here effectively to help solve problems. If we're not solving a problem, you know, we won't last in this system, as we all know. And if there is a really challenging time, to seek out some industry partners that potentially you have already partnerships with or have a good communication channel with, and actually saying, well, can you help me solve this? Might not lead to anything, but just opening that conversation up, just, you know, more heads on the same problem.
Totally.
Rather than always thinking that, well, industry always wants something out of the NHS, I guess. Sometimes the feeling I've experienced is people think, well, they just want to sell me something, so I don't want to communicate.
Sure.
And, you know, I've been there. I've felt it myself sometimes. And sometimes that is the approach as well. But a lot of the time, certainly I feel that, as you said, you know, you rightly said about the digital health ecosystem, which is full of sort of niche SMEs, which have mostly been born out of passion or people who have experienced a problem themselves. That kind of ecosystem is just full of, as I say, passion to improve the NHS rather than just, you know, where can I make my next sale? And yeah, it's just important to recognize not everybody in industry is just going to be there to make money. Of course, that, you know, you're commercial and you have to do that on the side. But like you say, in certain challenging times, you know, they in industry could be part of the solution. And yeah, I think that's a really good point. Yeah. So you've referenced IHI a couple of times. Tell us a bit more about that organization, because obviously you've been to a few conferences. What does it do, and how do you engage with it?
I don't know whether I'll do this one any good. I mean, yeah. So the Institute for Healthcare Improvement is on a mission to help improve healthcare systems globally. Mm-hmm. A lot of their work, I suppose, is consulting, but they run these fabulous events that bring people from all over the world as improvers to discuss the latest QI methodologies, successes, projects, programs of work. They run courses. They run a school. They have lots of improvement faculties and things like that. I'm probably not doing a great job, but their website is fabulous. And they publish white papers and resources and blogs, and in particular, the IHI framework for joy in work is something that a lot of NHS organisations were looking to implement and are still looking to implement. The framework came out in 2017, but it's still very, very relevant. Nothing moves particularly fast in healthcare. So things that got published 10 years ago are still very relevant.
Yeah.
And so, you know, the reason we came about that really was through partnering with East London NHS Foundation Trust, and then through attending the conferences and meeting people in that world of quality improvement. That's where, you know, we've been part of the conversation, and a lot of our partner organisations will go and present their posters or presentations at these conferences. And so, yeah, it's been a wonderful community. IHI have been a wonderful partner. We supported one of their international Joy in Work collaboratives. And yeah, they're just a great bunch of people that go to those conferences, great suppliers in the space, you know, so we all sort of know each other, which is really nice. Our platform, I suppose, is kind of methodology agnostic. So, you know, there are lots of improvement methodologies out there. IHI just happens to be the one that most of our customers are using.
So you mentioned how you're backed by some great investors. So you've obviously been through fundraising, etc. Tell us about how you've approached that fundraising journey. And I guess, you know, anybody who's listening who's at the start or thinking about fundraising, what would your advice be to them?
Yes, this could be a podcast episode in its own right. So my background, I really thought I had this nailed. You know, I kind of came into this thinking, oh yeah, you know, the fundraising bit, not a problem. What I didn't realise was, of course, that my job before had involved raising money for established businesses. So businesses that were listed on the stock exchange that you know were 15, 20 years old, that have a different set of investors, through to I supported Circassia Pharmaceuticals through its initial public offering, IPO on the London Stock Exchange. That was a different process. And then working for GHO Capital, it's again a different world of investment. So actually the startup end of investment, where you are getting people to back a very early stage risky concept, is entirely different. So it was very much sort of Dragon's Den, going and standing on stage and pitching to angels and high net worth individuals. The government offers tax relief to early stage businesses, so SEIS and EIS, which is a great scheme that really helps persuade people to back these young businesses. So I was very lucky to get investment from groups of individuals at Angel's Den and Angel Academy, in particular. So yeah, we've done 3 sort of little investment rounds. The first one was to essentially rebuild our product from scratch and rebuild it for scale, because when you're developing a product, it kind of grows arms and legs, and it, you know, you bolt on various bits, and then when you know what you've got, we then built it for scale with offline mode and multi-language and all sorts of stuff in there. The next little bit of investment we got was after the pandemic, was really to fuel our sales and marketing. And the last bit, which was a couple of years ago, was to help us launch a US a sales effort. So we've been very focused on why are we raising this money? What is it for? And what's the right fit of investor for this stage of business? And for anyone that's unfamiliar with investment, you'll hear a lot about, you know, VCs and Series A and and it all sounds a little bit overwhelming. There are good resources out there, and there are lots of sort of networks and foundations that help young businesses sort of try and get investment, all sorts of investment that you can get, and it really depends on what stage of business that you're at, what your risk profile is as a business, and what you need it for and what you're going to do with it. And importantly, when you take on investors, you know, how are you going to deliver them a return in the future. So it's definitely been an interesting journey and a sort of string to my bow that I didn't have beforehand. I wasn't complacent about it. I just thought I knew. And actually, it's very different raising money this side of the sort of early stage startup bit versus established, publicly listed, biotech company that's been around for 20 years, and anywhere in between.
Yeah. And what would you say were the most challenging parts of it? So obviously you've talked about how important it was to be really clear and specific what funding you needed and what type of investor is right for that sort of stage for you. But what did you find particularly challenging about it?
I think you're going up against a lot of companies.
Yeah.
So if you're talking to a health tech specialist investor, you might be going up against, the hundreds of innovators that are in this space. And so, your pitch has got to be really good. You've got to time it well, in the sense of when are you going to come and speak to investors? Why should they invest in you now? Do you have the right proof points?
Yeah.
All of that. What's the market, opportunity, all of that. So that's if you're speaking to specialist investors. If there's not a huge amount of specialist investors in the UK. So if you're speaking to more generalist investors, then, you might be pitching against a food and beverage company or a drone company or, an AI robotics company. And so, it's very difficult to stand out of the crowd. And obviously on the investment side, you've got to pick the winning companies. So it's very tricky to kind of get that matchmaking process right. It's very competitive. So so obviously, the more traction you have, if you've got revenue, fabulous. If you've got profit, fabulous. All of these things just sort of match you with a different type of investor.
Yeah.
So I guess, again, I'm probably at a bit of an advantage because I know how to approach this sort of thing. But for anybody who doesn't, it's about understanding what type of investor is out there. So anything from angel investors or high net worth individuals who are looking for their SEIS or EIS relief. There are then funds that do similar. You've then got family offices who invest in slightly different types of companies. You've got venture capital firms. You've got people that will lend you debt. And then there's a whole world of other kind of instruments that
Indeed.
So it's really about understanding what kind of investment you need, and then do you just need the cash, or do you need investors that can actually help you? So do you want to go and partner with an angel investor who's been there and done it 5 times over and can help you with customers or partnerships or internationalization? Do you want a venture capital investor who has a portfolio of companies that you can then join forces with? So as I say, it could be an episode on its own, but it's very challenging. But also, we're lucky to have got such great investors behind us. There's a nice matchmaking there. You're a founder, you've got something of value, you need help in scaling it. So simplistically, how can you find the people that can really give you that boost and help you on that journey?
No, that makes sense. And obviously through this journey, you've scaled the company, you've grown a team. What's been your approach to building a successful team around you, especially when you're scaling a company and growing? Perhaps the way to communicate that vision suffers sometimes because it when it's small, when it's like 2 people, 3 people, it's easy to achieve that. When you're growing, it's much harder. What's helped you keep that vision alive and sort of grow a team around you?
We have been very lucky that I think when people see a job advert for ImproveWell or they hear about ImproveWell, it's quite a nice, I can think of a better word than nice. It's a great mission to get behind. I think people straight away understand that, they want to give the frontline a voice and that sort of thing. So we've been lucky to have attracted very passionate people in the team. Some of my team have worked with me for years now, and of course, people have come and then sort of left and gone on to achieve great things, which is also wonderful. And we've got a lovely group of alumni that, all keep in touch and that sort of thing, which is really nice. So we really have stuck to our values on this. And I know everyone says they do, but we really, really do. And, it's listed in the job adverts, and we talk about life at ImproveWell. Not everybody truly knows what a startup environment is like. It's kind of like, you come in and yes, there are structures around you, but really you do have to roll your sleeves up and problem solve and be innovative and that sort of thing. We're very big on communication internally, of course, another theme that I've spoken about, but we have our annual goals that are broken down into kind of quarterly goals, monthly goals, even weekly. The team will sort of say what they're doing each week, and there's accountability and visibility. So we try and attract very passionate people who can really get behind what we're doing, who can also, really add value. So I don't know how to, I'm not a marketer. I'm not and it's funny, as a founder, people often look at you and go, oh, Lara, how would you do this? And I'm there going, I don't know how to do this. Like, I might have my way of doing it when it was just me, but actually I need to learn from you. So we've also been very flexible with working with people who are perhaps fractional experts in their field, and they might be working with 2 or 3 companies, and they give us 1 day a week or 2 days a week and that sort of thing. And that's been great. So I think in the age of being able to have home workers and sort of a remote workforce, it's really opened us up to being able to work with talented people across the country in a really flexible way. So
that's really nice. So let's just talk about the digital health landscape for a moment. I mean, lots is going on. There is the influx of AI everywhere in every possible way, in all our lives, in every sector, not just healthcare. But with all of this sort of new tech or new solutions coming to the market, what do you think, or what do you find the most sort of exciting thing that's coming, or perhaps the biggest opportunity?
I think the advent of AI and large language models, of course, has just completely revolutionized our day-to-day lives as just normal civilians, I suppose. So that has been really exciting. And I think we're all kind of getting to grips now with how this sort of new technology can really help us in our daily lives or help us in our jobs. I mean, I mentioned this earlier. I think healthcare doesn't necessarily innovate at the pace that perhaps other industries do. It's a highly regulated industry. You can't move fast and break things in healthcare. So the problems we're solving as innovators are the same, really, as they were 10 years ago, maybe even 15 years ago. So I think it is really exciting to see the uptake of digital technologies, and it was really encouraging to see that after COVID. It brings with it its own challenges, because the rapid uptake of anything then needs a bit of a bedding in period and that sort of thing. So, but I think the ability to crunch through large data sets and to surface insights that otherwise are being missed, or to help people make more efficient, quicker decisions, that sort of thing is really exciting, because if we can ultimately help healthcare become more proactive rather than reactive and be a continuously learning industry, that would be fantastic. So I guess it's an obvious answer in the sense that these AI and large language models are revolutionizing everything. We've been focused on that for the last few years, but obviously, with the likes of ChatGPT and everything else, now I think the world is realizing. But I think that healthcare doesn't sort of change overnight. And so it's not really an industry necessarily that I would see getting excited about the next best thing. They are still tackling big problems that have been there for a while. And so innovation may not be at the pace that everybody is expecting, but it is happening.
Yeah.
And of course, there are articles and headlines. I saw recently brand new virtual hospitals opening up.
Yeah.
I think in Manchester, and so there are big things that are happening, which is incredibly exciting. But it probably took a while, to get there. So change is happening. It might just be invisible at times. So yeah, I guess we are going to see now people adapt to this new era of these large language models and crunching through enormous data sets and surfacing insights. But I think we still need to operate in the same way, in that it does take time. You've got to be continuously learning. You've got to learn what doesn't work just as much as what does work. So it's an interesting era for sure that we're entering.
Yeah, no, definitely. If you were going to advise, a young Lara, to 9 years younger Lara, who was just about to set off to join ImproveWell and sort of solve that pain point. I know you've said, obviously, that the core of the challenge that you're solving today has not perhaps changed from sort of 9 years ago. But in this sort of high-tech AI coming in through everywhere world, do you think you would have still launched ImproveWell today in this environment? And if you were launching it today, would it look different?
Well, I mean, so yes, I would still do it all. I think there is still a problem to be solved with what we're trying to do. I think if I could give my younger self a bit of advice, it would be, don't underestimate the conversations that are going on when you're not in the room. Sometimes I think it can feel a little bit bleak when, perhaps business has slowed down or, there's been an unexpected development and, you're not quite sure how to navigate it. And perhaps you're not, the communication with your customer base, not your existing customers, but your future customers has gone a bit quiet, whatever it might be. But you just never know the impression that you've left on somebody. And actually, conversations are continuing there internally. You are being discussed in meetings. You are, someone is working on a business case. And actually, when they get back in touch, people are ready to go. So there's definitely been times where, again, it's that lack of communication just brings uncertainty. So yeah, I would tell myself, don't underestimate your progress. And as I said earlier, progress can be invisible at times, but it is still progress. There is still impact. You know, you are making a difference. And I suppose the second thing, which is not going to be new advice really, but it is genuinely true, is to just trust my gut a little bit more. So, when something hasn't felt quite right, I've probably mulled it over slightly longer than I should have. And actually, you end up being right about it. So, whether that's a particular hire or a particular project or a partnership or whatever, if you're just instinctively feeling like this is not quite how it should be, chances are it probably isn't. But again, when you're a young company, sometimes you don't have that experience and that track record to go, no, exactly. And actually, it's hard to say no. So, when someone's asking you to do something or develop this new thing or whatever, and you like really don't want to say no, but actually you sort of think, well, if I develop that and then you stop using it, I've just gone and developed something. And, so, and actually, when you are 9 years old, you can say, oh, actually, this is our process for feature development or whatever it might be. So there's definitely been times along the way where I've sort of gone, I'm not sure about that, but you've got to the right conclusion in the end, but you actually could have probably got there a little bit quicker. So
but I guess that bit is a bit of a chicken and egg, isn't it?
Totally.
You probably have that hindsight after 9 years.
That's it. It's easy for me to say it now, and I don't. As I say, I don't think we would have done anything differently. hindsight is a wonderful thing.
It is, isn't it?
And actually, you do feel different 9 years in than you do 2 years in. You do. And as I say, the problems that we have today, I would have dreamed of 7 years ago. So, it's been a privilege to be on this journey.
Yeah.
And we're still learning. We don't have all the answers. We still have challenges.
Yeah.
But we just approach them in a slightly different way now because we've afforded ourselves that option.
Yeah.
Because we are a bit more of an established business now.
Yeah, no, absolutely. And perhaps my last question is for brand new innovators or brand new entrepreneurs who are just at the beginning of their journey. What would be your top 3 things they should do or focus on in that sort of first 12 months to get their venture off the ground?
Speak to your customers. Ideally spend time with them if you can. I don't know if it's possible to go and do some shifts or go and do some voluntary work. Be there, be in the environment.
Yeah.
So that's my first one. Research, do a lot of research. Like I say, if you don't have the evidence base yourself already, go and get that compelling evidence base.
Yeah.
And the third one, really think about, is this a genuine problem?
Yeah.
And who is going to pay for this problem, because as we've said before, I think we're all very passionate about this industry and we're all trying to solve things. But sometimes you can lose focus on that and get swept away, with the sort of the detail of it. And actually, if you're not doing the first 2 things, like staying close to your customers and doing your research, then you could find yourself just developing something that is really great, but ultimately, maybe people just continue doing what they're doing or they find a slightly different way to do it. And we see that in the consumer industry as well. So those would be my 3 things.
That's fantastic advice. Thank you so much, Lara. It's been an absolute pleasure to get to know you and ImproveWell's journey a lot more. Thank you for your time today.
Thank you very much for having me. It's been really fun. Thank you.
That's it for today. Thank you so much for listening to this episode, and thanks once again to Lara for being so generous with her time and her insights. And thanks to her and ImproveWell for the incredible work they're doing to support innovation in the wider and broader frontline of the NHS. If you enjoyed this episode, please don't forget to like, subscribe, and indeed leave us a rating. We'd love to hear from you. Until next time, bye-bye.